So I'm from Miami. I am a dermatologist and surgeon, and I deal with HS for as long as I have been in practice. And I'm going to skip the advocacy stuff because I have a kid with a chronic disease, so I am her best advocate, and when you are going to your physicians, you are your best advocate. And what we're going to talk about now, this is where most of you are coming from. If you have been lucky enough to find yourself at Dr. Hamzavi's office or someone in the neighborhood who can understand where you're coming from, you're a step up. You've got pain, you've got pus, you've seen 3 or 4, 5, 6, 7, 8, 9 physicians. You don't have a diagnosis, you don't know where you're going. You have built a wall around yourself because you think no one wants to be near you, and you are depressed. And we've beaten this to death. It's not an infectious disease. It's not caused by being dirty, and it's certainly not caused by being overweight. It's not contagious. It is a pain in whatever piece of anatomy it's bugging you in. I can skip this one too. So, I was always taught, particularly by my father, who is also a dermatologist, that when I see a patient, no matter what I'm dealing with, I want to give them a name, I want to tell them what I'm going to do, what I'm going to use, how long it should take, and what's going to happen in the future if it doesn't work. And that's how I deal with HS. So you guys are going to be looking at websites, you're going to be talking to your friends, you're going to be on message boards or Hope for HS, perhaps even your internist or pediatrician or primary care physician, although that's unfortunately few and far between. When you go to see the person who you feel is going to be your best hope for getting some treatment or some information, you want to bring your medicines, the stuff you've used, what worked, what didn't, how long you used it for, because if you use it for a week and a half, that's really not valid. Any procedures you've had done in the past, and procedures can be incision and drainage of an abscess to a huge surgery like we saw earlier today. Most recent blood tests are super helpful because if we're going to put you on Humira or Remicade and you say, oh, I've already been tested for TB and I'm pretty healthy and my liver's fine, we need to have those tests. You need to bring an open mind because I always tell patients I am so far outside the box I can't see the box in terms of the stuff that I use. Because if I see a paper out of Uzbekistan and it showed that one patient benefited from some kind of bark from their tree, I'm going to get that stuff and I'm going to use it in someone. I think the most important thing you can bring with you to your visit, particularly your first visit with a physician, is a family member. Because if you haven't been diagnosed and you are thinking I've got HS and then you get diagnosed, ears turn off. And your family member is going to be there and they're going to be the one writing everything down because you're going to be sitting there, shit, I have HS. I knew it, but now I really know it. And it's good to have someone there to be your memory aid. What we do, intralesional. A lesion, you know what a lesion is, it's something on you. We're going to stick something into it. That's intralesional. Intramuscular, I use a lot of intramuscular cortisone because it's a good jump start for whatever I'm going to do, and it's a great rescue if you're in the middle of a flare. Intramuscular means into the muscle. Incision and drainage, cut and drain, cut and slice and dice. It's when we have to open something up to let pus out, to let pain out. On roofing, we're taking the top of the skin off of a tunnel. I do a lot of surgery for HS as well as every other medicine known to mankind, and some that are only known by aliens. These are a few of the things that we do. Step therapy, I am not a fan of step therapy no matter what it is. I want to bring my A game. I want to beat your disease into submission and keep it in submission. So I don't like giving you a cream and say, come back in a month, tell me how it went. I'm always worried about quality of life. And I do have discussions with you about how it's making you feel. How's your wife or your husband dealing with you? Are you got a job? Can you work? I want to be treated. I'm treating you the way I want to be treated, and you need a physician who's going to do that for you. Is your physician empathetic? Is he or she, and I'm going to say he because that's what I usually say, is he sitting there on the chair listening to you? Body language, greater than 50% of any conversation, and it's the nonverbal part that you're looking for. Do you feel you're being heard? Or is he asking you about your mental health? Is he confident that he can fix what's going on with you? And I use fix in a loose term to get you better. That's the point. To get you to be comfortable, to get you to be able to function in your activities of daily living, to be you. Is he really getting annoyed when you keep asking questions that you think are really important, but he thinks are really stupid? There are no stupid questions, just stupid people. So if he's not listening to you, you need to find someone else. And how do you connect with the office? The doctor may be great, but the office may be a morass, a swamp through which you've got to slog, and sometimes you fall right into the quicksand and you never come out. Is he talking to you about Family Medical Leave Act? Is he talking to you about handicap stickers? Because this thing handicaps you. If you can't walk 20 feet without bleeding or dripping, that's worth a handicap sticker, at least for the interim. Got one more minute. The takeaway. There are medicines out there that help with HS. I look at you as doors, and I've got a big janitor's key ring full of keys. Some of them won't even go into the lock. Some of them will go halfway. Some will turn. Some will open the door. So some of the things work for some of the people some of the time. I'm looking for the thing that works the best for the most. I'm willing to talk to your family. I'm willing to talk to your doctors. In fact, I will demand to talk to your physicians, the other people who are helping care for you, particularly with endocrine problems, thyroid, diabetes, metabolic syndrome, high blood pressure, because the medicines I use are going to have interactions, and I want to know about them. And the best thing you can find about your physician is whether he or she thinks outside the box. So, there you have it. Go out and get a good one.